Hi there, my name is Georgina and I'll be presenting my topic, dysmetria. So dysmetria is a neurological condition which is characterized by a lack of judgment in distance, which causes error in trajectory during movement. So this condition impacts joint in the upper and lower extremity and also impacts eye movement, which is called saccadic dysmetria. Dysmetria, along with other neurological conditions, results from the impairment to the cerebellar structures and also linkages to motor output. So there are 5 main features of dysmetria. Number 1, it is speed sensitive, which means that it affects the rate of movement. Number 2, it is inertia sensitive, so patients often don't really perceive the orientation of their limb. Number 3, it has increased intra-trial variability, which just means that every time they perform a motor task, it's different in every instance. Number 4, increased curvature of movement. And number 5, there is an impairment of initiation during movement, so often there is a delay. So the pathophysiology of dysmetria. So as mentioned before, cerebellar dysmetria affects upper and lower limbs. It can impact large muscle groups across single or multi-joints. So the output of the cerebellar cortex is represented by Purkinje cells, which is located in the layers. So these synapses travel in contact with parallel fibers to reach myotomes, which then actions on motor activity. So in this condition, projection of these synapses to parallel fibers across the dentate nucleus make links to stellate and Golgi cells, which are located in muscles. Damages to these structures, it can be following a cerebellar stroke or just from a degenerative cerebellum, can cause misfiring of these synapses, which affect granule cells from motor cortex and the spinal cord. And as you can see in the figure there, the dentate nucleus is part of motor planning. So if that is damaged, so are firing of these synapses. So the signs and symptoms of dysmetria. So often you will find that dysmetria occurs with other disabilities. So patients with cerebral palsy or that have had a stroke actually have similar symptoms. But the main symptoms is overshooting, which basically is overreaching a target or going past the target. You may also see oscillations, which is referred to as an intention tremor, which is basically trembling in the limb. And you might also see oscillations in the eye, so the eye moving back and forth in a rapid manner. So how does dysmetria affect movement control? We have hypermetria and hypermetria, which is basically overshooting and undershooting respectively on distal and proximal joints. In the figure shown here, this patient his intent is to touch his nose, however he does go far beyond that, so that is referred to hypermetria. We can also see the oscillations there and also characterized by the delay there on the abnormal waves. Patients also have the inability to seize a movement. For example, discontinuing flexion when exposed to resistance. They may also struggle to change direction of a movement. Patients also show staggering of a movement during testing. So for example, we might see that they show a stop and go effect while trying to, let's say, draw an imaginary circle with their finger or leg. Most patients also complain of weakness in the limb that's affected, and that can be present when the hand or limb is dominant. So what are some treatment options for dysmetria? There are some drugs that can help reduce oscillations. However, exercise interventions have shown a decrease of the disease progression. In dysmetria, exercises that help in performing the motor skill or regaining the ability to perform a motor skill in a consistent rate can be prescribed. So for example, if the person's goal is to hold a cup of coffee again, as the example before, then the health professional will be focusing on exercises of the upper limb. Static and dynamic exercises, isolation exercises, whole body balance exercises, and just general exercises that improve posture and gait should be prescribed, bearing in mind that any attacks the disease, patients tend to show weakness in posture and gait. If hypermetria is present, stretches should be prescribed so that the patient can also regain the range of motion. Thank you so much for watching. These are my references here. I hope